Bioethics 2.0, Podcast Episode 6, Ethical Responsibilities of Nurses. Bioethics 2.0 Podcast Episode Guide. This is Podcast Episode 6, Ethical Responsibilities of Nurses. You can find this information in Introduction to Clinical Ethics by Fletcher, Chapter 2, as well as the Practical Ethics for Nursing and Nursing Students Guide, Chapters 1 and 7. What is nursing ethics, and how does a nurse behave ethically?
This podcast episode deals specifically with the professional responsibilities of nurses.
Nurses' ethical duties.
The American Nurses Association, the ANA, Code of Ethics for Nurses with Interpretive Statements is viewed as one authoritative source of delineating nurses' professional responsibilities. Therefore, it is important to briefly highlight what the ANA Code says. There are many different principles, and we will discuss them here briefly. The first is that nurses should act with compassion and respect for all individuals. The second is that the nurse has a primary commitment to the patient, whether that be an individual, family, group, or even a community as a whole. The third point is that nurses must promote and advocate to protect the health, safety, and rights of the patient. Nurses also have a responsibility and have accountability for nursing practices and to optimize patient care. Nurses also have a responsibility to preserve integrity and safety for themselves and maintain their own competence and professional growth. The last points on the ANA Code for Ethics are as follows. Nurses also have an obligation to establish and maintain improvement of the healthcare profession as a whole and the environment in which healthcare is provided to ensure quality healthcare. They must also contribute to the advancement of the profession through practice, education, administration, and knowledge development in nursing practice and nursing science. They need to be able to collaborate with other health professionals and the public to meet individual and community healthcare needs. In addition, and lastly, the profession of nursing is responsible for articulating nursing values, for maintaining professional integrity, and shaping social policy. Nurses' rights.
When caring for patients, nurses have rights that must be respected. The first is that a nurse may refuse to care for a patient when it requires them to perform treatment that is beyond their capacity, training, or expertise, or if it may jeopardize a patient's welfare. In addition, nurses have the right not to be abused in the workplace. Nurses may also reject a specific assignment if they feel that it puts them in jeopardy or their patients in immediate jeopardy. What are patients' rights, and how can nurses promote the right and dignity of the patient?
Nurses should be familiar with patients' rights, as many healthcare organizations may have specific policies. Here are some likely rights that you will see as a professional nurse. Patients cannot be denied appropriate care on the basis of race, religion, gender, sexual orientation, or other factors. In addition, patients should be treated with the utmost respect. Patients should be able to make healthcare and ethical decisions regarding their healthcare. They are entitled to know who is caring for them, and they are also entitled to know their prognosis and information regarding their treatment in understandable terms. Patient records must be kept confidential, and patients must have access to their medical records. Also, excluding emergency situations, patients must consent to participate in research or to receive treatment. Patients may refuse treatment and must be informed of medical consequences that might result from such refusals. Again, excluding emergency situations, patients cannot be transferred to another facility until certain conditions have been met, the primary one, of course, being the stability of the patient.